This show is for educational and informational purposes only. It is not to be used for diagnosis, evaluation, prevention, or treatment, which requires your medical team. Today we're going to talk about a real clip joint. That is, where and when you need to have your nails trimmed when you have diabetes. When you have diabetes, your disease process forces you to take extra care of how you take care of yourself, your feet, and your toenails. Toenails are one of the most common problems of the feet, and problems of the toenails can lead to a loss of limb in diabetics. So let's see how to properly take care of your toenails when you have diabetes. Nail salons for manicures and pedicures are interested in aesthetics and how the nails look, and their technicians are not deeply immersed into diabetes care. When you have diabetes, you may experience complications of nerves and circulations, which combined with aging can make a very fragile diabetic foot. A real clip joint for diabetics is with a podiatrist, foot clinic, foot care nurse, or your doctor. Their tools are sterile and clean. Their job is to safely care for your nails and you, and to teach you how to take care of yourself with diabetes. We're going to talk about how to be safe with self-care for toenails for people with diabetes. Although you may have never seen someone take a hand shovel to dig into the corner of a toenail, many objects have been used to dig into the corners of a toenail, such as pocket knives, sewing scissors, and wire cutters. Do not dig into the corners of the toenail. You may cause an ingrown toenail. Ingrown toenails most oftenly occur on the big toe. This is a common site for an ingrown right here that is visualized in this slide. This patient has dug into the corner of their nail. They have rounded the nail almost like a fingernail, and they have dug into the corner. This sets up the conditions for an ingrown toenail to happen. In this slide, we see a nail clipper, a nail file, and a nail nipper. The nail clipper has plastic surrounding it. This aids in the clipping action. The nail nippers are like scissors in a way, but designed to cut toenails. Take small bites when you use this, and it works very well to cut some difficult to cut nails. Now, if you need to be very careful with your feet, the nail file is the way to go, and you can file your nails. The nail file to use is the one they use on artificial nails. It's a little bit coarser and it files the nail a little bit easier. The length of the toenail is not to be longer than the length of the toe. So when your toenail grows longer than the length of the toe, trim it straight across and file the corners to the shape of the toe. What to do if you nick yourself while trimming your nails? Well, first, wash the area with soap and water. Cover with a bandage, but one that is not thick, so it puts pressure on your toe in your shoe, and do not wrap it too tightly that it cuts off circulation. So you don't want the bandage too thick. 2, if the nick does not heal right away, call your medical team. 3, if you have numbness, neuropathy, or poor circulation, contact your doctor right away. And 4, if you see redness, swelling, or pus, call your doctor right away. So you want to make sure that this is not getting infected and that it heals in a timely fashion. That's why you want to keep your medical team informed so they can catch a problem early and it can be solved easier than in its later stages. Be smart and know when you need professional care. Ask for help when you need it. Have a foot doctor or foot nurse trim your toenails if you cannot see your feet. If you have poor circulation. If your feet are numb. If you cannot reach your feet. If your toenails are thick, deformed, or yellowed. If your nails curve and grow into the skin. If you cannot cut them safely. Now we're going to talk about nail deformities. Thickened nails, ingrown toenails, and nail fungus. Thickened toenails can get quite thick. The thickness of the toenail can put a lot of pressure on the toe, especially if it gets trapped between the shoe and the toe, the unforgiving shoe. Ulcers can form under thickened toenails. Have your thickened toenails professionally reduced or eliminated. Thickened toenails may be infected with fungus. As a diabetic, you should have your thickened or fungus nails treated professionally. Thickened or deformed toenails are caused by injury, infections such as fungal, yeast, mold, or bacterial, inflammation, illness, or birth defect. The nail can be reduced or removed to prevent problems. In the blue circle, we can see at the end of the toenail that it is separated from the skin under it, the nail bed. This opens up the nail to a fungal invasion. Now we're going to talk about ingrown toenails. If you dig into the corners or trim your nails too short, you are more likely to get ingrown toenail. Ingrown nails can grow into the skin and cause an infection. Have ingrown nails professionally treated. Do not wait for an ingrown to become infected before you have it treated. An ingrown toenail is a nail that grows into the side of the toe from the outer margin of the nail plate. It will have tenderness, swelling, pain, inflammation, or infection. It most commonly affects the big toenail. In the blue circle, we see a pincer nail. A pincer nail is a nail that has its sides curved deeply in. It is prone to have an ingrown or to have thickened skin in the nail grooves. Onychomycosis is nail fungus. It usually shows up as a thickened yellowed nail. Dermatophytes cause 90% of onychomycosis or nail fungus. And the dermatophytes are the fungus that likes the skin. They're the same ones that do athlete's foot, jock itch, ringworm. Those type of infections are all the dermatophytes. Also, what can invade the toenail is a yeast, Candida. Molds can invade the nail and some bacteria. In this picture, we see fungus invading the nail. This infection will soon overtake the entire nail, making it thick and deformed. With diabetes, fungal nails should be treated. Fungal nails can be thickened, and the pressure from the shoe can cause an ulcer under the nail. Now we're going to talk about how to treat these conditions. Remember always to seek treatment early. First, we're going to talk about treatment of ingrown toenails. A nail can be avulsed. That means the nail is removed, but it can grow back. A portion of nail can be removed. This is known as a partial avulsion. A complete avulsion is a nail that is totally removed and the entire nail can grow back. Certain types of ingrown nails respond to this treatment. Another treatment for ingrown toenails is the matrixectomy. A matrixectomy removes the nail permanently. A matrixectomy can be partial or complete. If a nail is ingrown on both sides of the nail, two partial matrixectomies can be performed. Thus, you will have a narrow central portion of the nail left to grow back, without the ingrowing portions. Treating ingrown toenails may require antibiotics. Also, ingrown toenails can have biomechanical causes. How the foot walks may need shoes and orthotics to help correct this condition. Of course, there are other treatments. How to treat onychomycosis. Onychomycosis means fungus nails. Debridement means to clean and reduce the nail so that it looks more like a normal nail and doesn't put pressure on the toe. Antifungals can be used to kill the fungus, and it can be used in pills or topicals. Sometimes biomechanical treatment may be needed with shoes and orthotics. And of course, there's other treatments like laser and other things that can be used to treat onychomycosis. How to treat thickened nails. Thickened nails can be treated with debridement, which means to clean or reduce and reduce. You can avulse the nail, which means to remove it, or you can do a matrixectomy, which means to remove the nail permanently. You can use biomechanical shoes and orthotics to help with thickened nails, and of course other treatments. Other causes of nail deformities include poor circulation, arthritis, and other systemic illnesses. In summary, we have some things we should remember. As a person with diabetes, you have to be extra careful with your feet. There are certain things that you shouldn't do as a person with diabetes. Don't cut your nails back to the quick. Don't let your nails grow beyond the end of your toe. Don't cut all the toenail at once. Cut the toenail off in small bites. Don't dig into the corners of your toenails. Don't blindly cut a toenail you cannot see. If you can see, reach, and feel your feet, trim your toenails regularly. Some people say even weekly. Trim your toenails with nail clippers after you have washed and dried your feet. Trim your toenails straight across and smooth the corners with an emery board or nail file. This prevents the nails from growing into the skin. Do not cut into the corners of the toenail. Have a professional trim your toenails if you're a person with diabetes and you cannot see your feet, or if you have poor circulation, or if your feet are numb, or if you cannot reach your feet. If your toenails are thick, deformed, or yellowed, if your nails curve and grow into the skin, or if you cannot cut them safely. A professional is a foot doctor, such as a podiatrist, a foot care nurse, or your family doctor. As always, we are friends in the fight for feet. This is the Diabetic Foot with Dr. Joe.